a record for Kentuckians on ventilators. And today, I can report that now over half of all of our hospitals, 50 of 96, are reporting critical staffing shortages. Let me say that again. Over half of all Kentucky hospitals are reporting critical staffing shortages. We are seeing things like T.J. Sampson Hospital, which ran out of ventilators, meaning every ventilator they had for normal care had somebody on it. The state was able to deliver more, but it shows you the level of the seriousness. We have taken some steps that we talked about yesterday. The first was a National Guard deployment that begins on the 1st. 7 teams that will be helping, I believe, in the beginning, 3 to 5 hospitals. We have made our request to FEMA for a nurse strike team. That'd be 100 individuals. We've not heard back on that one yet. But also the EMS strike team, which we not only got the okay for, but they are now in the state. These teams, which remember are, I believe, 5 advanced life support ambulances and 30 personnel, are going to be operating out of 3 cities. That's Louisville, Prestonsburg, and Somerset to begin with. Now, in Prestonsburg and Somerset, they're going to be helping on regular emergency runs. That's because the staffing is short in those areas with COVID, and it's become a challenge. In Louisville, they are primarily, if not solely, going to be doing patient transfers. Louisville has some of the higher trauma level hospitals in the state, meaning they can take care of sicker patients. They have pediatric ICU, meaning they can take care of kids that are sick. So these are, from FEMA, ambulances that will go out to communities, get those sick patients, and bring them to the hospital so that Louisville's EMS can do their regular runs. The goal here is to not interrupt that regular emergency service. Third step we are taking is taking over testing in some of the hardest hit hospitals to free up clinicians. Heard from St. Clair this morning. The testing we set up is up and running. It freed up 5 clinicians that now can staff more beds. But folks, it is as bad, no, it's worse from a hospitalization standpoint and a hospital capacity standpoint than it's ever been for any reason, certainly in my lifetime. You are at more risk now if you are in a car accident or have a heart attack of not getting all the services you need than ever before. Now, some better news as we move into today's fun part. Between yesterday and today, 8,250 vaccinations. What that means is over the course of the shot at a million, we have seen a 50% increase in vaccinations over those 3 months, going from about 109,000 to 156,000. Our vaccine number today, 2,496,578. But if you also take into account the net Kentuckians vaccinated out of state, we are over 2.5 million of our Kentucky residents having taken at least their first shot of hope. So everybody out there, be careful. Get vaccinated and wear a mask when indoors, outside of your home. It's more important now than ever. And I mentioned yesterday, I'm changing my schedule as well. Large indoor events at this point have too great of a risk of spreading this virus significantly. And we'd ask people to either refrain from them or at the very least, make sure everyone's masked the entire time. All right. Good afternoon, everyone. We are here to announce the 3rd and final round of winners at our Shot at a Million sweepstakes. We had our first 2 drawings in July when I presented Patricia Short of the Lexington area and Louisville resident Ginger Schultz the first 2 $1 million prizes. And the children and families from Louisville, Elizabethtown, Princeton, Mount Sterling, Crestwood, Owenton, Harrodsburg, and Fort Mitchell learned they were receiving free ride scholarships to fund their post-secondary educations. Today, in just a moment, we're going to hear from our final new scholarship winners and a new millionaire. Before that, again, it's important that we talk a little bit about what we have done in this drawing and why we did it in the first place. We offered this drawing as a way to encourage people to do that right thing, to get the vaccine. The response we've had for the sweepstakes has been great. As of yesterday, 419,566 Kentuckians have received at least their first shot of hope since we announced this incentive. In total, 762,174 vaccinated Kentuckians have signed up for the $1 million drawing, and 47,544 vaccinated youth have signed up for the full scholarship drawing. But even with the sweepstakes and other incentives, we need more people to get vaccinated and to do it quicker than what we have seen. The Delta variant is burning through our population every day in this Commonwealth. Just yesterday, again, 5,401 new cases. That's 10,000 new cases over the last 2 days. And over the last 3 days, 4,600 kids testing positive for COVID-19. As we sit here today, largest number of Kentuckians ever hospitalized, ever in the ICU, or ever on a ventilator for COVID, and our positivity rate is the highest it has been since we had enough testing to accurately calculate it. So it is dangerous, it is serious, and preventable. You know, I've been traveling around the state to local health departments, to hospitals, to tell our healthcare heroes how much we love and care about them, how much we need them. In every single place, I've asked one simple question. If people out there say they care about you, what's the one thing they can do that would mean the most? And to a person, they have said, get vaccinated. They are safe. One is fully FDA approved, and the others will be soon. They are life-changing, and this is the only time in the history of the world that we have had a massive pandemic that we can defeat tomorrow. Tomorrow. So please, go to your drugstore, go to a grocery store, go anywhere that they have that vaccine and get it. All right, Brittany, we're going to have the fun part now. All right, we brought along the First Lady today who was on a phone call with a lot of the individuals that we're going to see. So together, Brittany and I are excited to introduce you to our third and final $1 million winner and our third round of scholarship winners. So to kick things off, let's introduce you to today's scholarship winners. First, we have 12-year-old Marissa Heron from Mount Washington. Marissa was not able to be here today, but she sent a video with her parents Tessa and Raymond.
Hi, I'm Marissa Heron, and over here is my mom Tessa. I thank God for this opportunity. I am so grateful for this. Thank you.
Can we do it one more time?
Hi, I'm Marissa Heron, and over here is my mom Tessa. I thank God for this opportunity. I am so grateful for this. Thank you.
All right. Next up is 16-year-old Lily Nielsen from Nicholasville. Lily's here with her parents, Andrea Nielsen and Peter Miner, and her sister, Bailey. Remember, Bailey, you are a winner, too. Come on up.
Thank you. I'm so thankful to have gotten vaccinated, which led me to this amazing opportunity today.
All right. Thank you.
We're very grateful. We chose to all get vaccinated because it was important to our family and for our community. Education is really important, and so get vaccinated. This is a great way for us to combine both. Being vaccinated, and now Lily has an opportunity to go to college thanks to Kentucky. Thank you all so much.
And thank you to Andrea for being one of our public school employees. We appreciate all of your work. Next, we have 13-year-old Jordan Ballard from Crestwood, who is here with her mother, Lisa, sister, Savannah, also a winner today. Come on up.
I got vaccinated so that I could help protect me, my friends, and my family.
And I just want to say thank you so much to Governor Beshear and the state of Kentucky for this wonderful opportunity for her to have a free ride scholarship. So thank you very much.
Next, we have 15-year-old Grider Birch from Lexington, who is here with his dad, Matthew. Congratulations again.
Okay, I just want to say thank you for providing this opportunity for me to get these scholarships. And I want to personally thank everyone that's actually gotten vaccinated. It helps those who are unable to get vaccinated and those who are immunocompromised. And it just brings us closer to that immunity from COVID. So, yeah.
I also want to reiterate, just encourage everyone in the state to be vaccinated. It certainly helps individual people, our loved ones, and those of us that we don't even know. And thank you very much to the leadership of Kentucky for this wonderful opportunity for the scholarships.
And finally, we have 17-year-old Jaden Watley from Louisville, who's here with his parents, Bridget and Jamar, and his brothers, Javion and Jackson. If you would please come on up.
Thank you. This is an honor for me to be here to award this scholarship. But I also got vaccinated to help support the engineering program at Ballard High School. So I'm here supporting Ballard and want a safer place for me and my friends.
Just real quick, I want to tell Governor Beshear, thank you for the opportunity. It's truly a blessing for me and my family. And also as a frontline registered nurse, I've given the vaccines, I've given the monoclonals, I've taken care of the safest to the sickest people. This is serious. Please get the vaccine. We're tired, but we're going to keep fighting a good fight. Just help and do your part for us. Thank you.
Oh, my goodness, thank you. Jamar, I didn't know that you were on that front line. Thank you so much. This is Healthcare Hero Appreciation Week. We appreciate you.
Thank you.
Thank you. And congratulations to all of our scholarship winners. Okay, now for the big announcement. The winner of the third and final $1 million Shot at a Million Vaccine Prize Sweepstakes is Mary Mattingly from Louisville. Mary, her husband Charlie, and their granddaughter Lila are traveling safely through South Dakota. We were able to track them down yesterday after the drawing and after they were able to pull to the side of the road because it would have been dangerous to talk to them while they were still driving. We told them the big news.
Hello?
It's Andy and Brittany and Lila Beshear. How are you?
I'm fine.
We hear you're in South Dakota.
We are in South Dakota. We take all good advice and have had a very socially distanced and masked trip. But of course, most of all, we're vaccinated, so we are hopeful and doing our best.
Oh, Mary, I appreciate that. What I really appreciate is you setting an incredible example for everybody around you, getting vaccinated and staying safe. And I'm calling with some really, I'm trying to figure out how many zeros are really good news. Mary, you are our third winner of $1 million.
Believe it. I am sitting in a car, so I'm not in a position to be able to jump. I am so thankful. I am so grateful. I am so honored. And I am just, I don't deserve it any more than anyone else who tries to do the right thing and has gotten vaccinated and has worn a mask and has social distance. But I'll accept it. I would like to say that more than anything else, I am so grateful for your leadership, Governor, and for your compassion. I just want to encourage everyone to please be vaccinated. I have 4 of the most beautiful grandchildren in the world, and of course, they were part of my motivation in getting my vaccination just as soon as I possibly could. And I thank you again for your leadership.
I've had time to calm down now, but at the time of the call, I was excited, very grateful, and a little overwhelmed. I still want to scream and run around, but I feel like I have to get serious. I have a small tree in my front yard covered with green lights in honor of those who have lost their lives to this unpredictable and frightening virus. I have loved ones who have experienced deaths of family members, and my heart aches for everyone who has experienced loss. Finally, I told the governor that I wanted to use this opportunity to encourage each of you to get the shot of hope. The vaccines cannot stop every case, but they can greatly reduce your chances of acquiring a serious, long-term, or fatal case of COVID-19. The Delta variant is running rampant. Hospital workers are once again overwhelmed. I ask you, really I beg you, to put aside your preconceptions and misconceptions. Do the research, consult your trusted medical practitioners, and get the vaccine. Then we will get through this. We will get through this together. Thank you, Kentucky. Or should I say, thanks a million.
Well, the thing about a random drawing amongst those that have been vaccinated is you can't ensure that they are in the state at the time they might win. But appreciate everybody for our communications team tracking them down. They've got a future as bounty hunters after, I think, all of this. But really excited to Mary as our newest millionaire here in Kentucky. So again, thank you to everybody who participated in these drawings. Listen, if you got vaccinated, you're a winner. You're absolutely a winner. You're a winner because you're better protected. You're a winner because your family is better protected. You're a winner because you're doing your patriotic duty to help us defeat this virus. So I think we got a couple of our families that are willing to take a few questions. Jaden, are you going to lead us off? All right.
Especially considering what your father does.
Well, I got the vaccine to help make a safer community for my school, Ballard High School, and safer community for the engineering program. And I also did it to help support the people, the nurses and medical family.
What school you're going to go to yet or anything like that?
Currently, at the moment, I am still making decisions of which school I want to go to.
About what you're experiencing.
So the scholarship is wonderful. I mean, it's good to hear. I'm happy. Thank God. I'm blessed for it. Even though this scholarship, yes, money, that's paid for. But the main thing is, I just wanted some good news. This past couple of years, have really been rough. For me and my healthcare friends, a lot of people are getting out. A lot of people are taking leave of absence, finding other jobs. So it's finally good to just hear something new, hear something good. Main thing.
Thank you all.
Thank you.
And I guess, why the vaccine and what does it mean for you to get this scholarship and have your education paid for?
I guess for me, just getting the vaccine was mainly for the people I cared about and also my own. And just the older family members I had because I knew they were at higher risk and that kind of thing. And then I think this scholarship is absolutely amazing. It relieves just sort of that stress of having to think about how I'm going to go to school and that kind of thing, I guess.
Thank you. All right.
So I got the vaccine because I wanted to protect myself and just the other people around me. It's just the right thing to do. And I think the scholarship will definitely helps us, like me and my parents, not have to worry a lot about debt and money when I just get out of school, which is a huge help since I know I have my brother and they both take a lot of attention. Both of us need a lot of attention. And so now just help relieve a lot of stress with my parents, which is great, and relieve a lot of my stress with money and financial aid.
Hey, Jamar, can you join me back up here? So again, folks, this is Healthcare Hero Appreciation Week, and I did not know that you're on those front lines. So this week, we signed our proclamation, making it official, and we wanted to make sure we got you an official copy here today. So thank you for all that work.
Appreciate it.
That doesn't come with an additional scholarship. I know you got 3 kids, but yeah. Thank you.
Thank you. Also, I want to say that my wife, she's also a healthcare hero. She works in the lab. You know, it's a group effort. Teamwork makes the dream work. Thank you.
All right, wait. She's got to come up too. Give me that back. No? Okay, this is for both of you. There we go.
Thank you so much.
All right. Great. I'm willing to take a couple questions. Yeah.
Governor, two-part question kind of, but first of all, you talked about how vaccinations have gone up 50% since this started. Do you think it's this, or is it because of fear of COVID with the Delta variant, or a combination
It's a
of both?
combination of both. So when we look at where we were in month periods, these aren't calendar months, but these are 4-week periods, we hit a high at almost 750,000 people getting their first shot of hope. We were able to do that in a month. That's an incredible logistics challenge and achievement. And then we saw it dropping, I mean, almost in half each month. When we announced this, it stabilized it. It was moving up some before the Delta variant took off, but certainly since then, we have seen more people get vaccinated. We've had some other things happen during that period too. FDA approval is probably a little bit early, but people should rightfully be very scared of the Delta variant. I mean, I've been careful about saying phrases like that, but this variant is that serious. It is that aggressive. Remember the numbers we put up yesterday, though, they're all about 90%. 90% of people in the hospital or that have been hospitalized in the past 3 months are unvaccinated. 90% of folks in the ICU unvaccinated. Deaths are 88, 89%. So it is a good reason to get vaccinated. Okay.
Mine, sir, is this is the last statewide incentive. What now? I know President Stivers earlier this week talked about local incentives, local programs. Is that something you think can be effective?
Well, first, local programs have been going on since December 15th when we vaccinated the very first people. The Franklin County Health Departments gave out pizzas that they had right there for people who would get vaccinated. Our MCOs have been giving people $100 who are willing to get vaccinated. We did free soccer tickets to professional soccer for it. Just about every community has done 4, 5, 6, 7 local incentive programs, and I'm for them anytime that someone wants to do them. But on a statewide level, I think a number of different things are going to be happening now. First, the Delta variant is so serious, I think you're going to see a lot of private sector or quasi-public sector entities requiring vaccinations. I think we've seen Bellarmine and Transylvania that are going to require it. We have seen others that are going to require testing from their employees if they won't get vaccinated. We're doing 1,000 vaccines, I think, on Tyson employees coming up. I think that's the next major driver, and especially as Moderna becomes fully FDA approved, I think we'll see a lot more of it. Tom.
Thank you. You also had the contest go to state park.
Yes. So we've got, and right now at the state fair, we have incentives where you get all you can ride passes, and you get a gift card that can be used there. And if you're WellCare, one of the MCOs, you can get your money right there too. Tourism is giving away staycations, is giving away rounds of golf, a ton of different incentives that are out there. I know school systems have offered incentives to the kids. We've got a free day off, we've got a paid leave day for any state employee that gets vaccinated. And we've been doing things like this the entire time. We are probably to a point where incentives are good and that they get out the word. And this contest, at the very least, created tens of millions of dollars of publicity about the vaccine. That's the other reason you do one of these. And local incentives get the word out more, which is helpful. I do think that we're to a point where incentives can probably only do so much to the populations that remain unvaccinated.
Governor, apologies to take a negative turn here, but I want to circle back to something you said earlier about hospital ventilators, that situation. Could you expand on that a little bit more, and also touch on the state's capacity when it comes to ventilators? Is there a certain amount that we have, and at what point do we start getting nervous about that?
We have more Kentuckians on a ventilator fighting COVID right now than ever before, and the rate continues to rise at a concerning level. It doesn't hit everywhere the same at once because, again, we have our higher acuity hospitals, Louisville, Lexington, and some other places, obviously, Ashland, and a few others that have more ventilators, that have big ICUs. And at least in two places, have pediatric ICUs. But then you start going out regionally, and your hospitals don't have as many ventilators because they don't have any ICUs. They're there in the emergency room in case something really bad happens, but you look at Ephraim McDowell, if you remember, their morgue only held 2 people, and they had 7 die over 3 days. So what we're seeing is hospitals that aren't used to taking care of critical patients are having to on a daily basis, on an hourly basis. And that creates a real stress on what they physically have. So this was T.J. Sampson, and we delivered 2 additional ventilators. I feel good as long as we get the information on the ventilator side that we can amplify hospitals that are out there. But if we continue at this rate, we ought to worry about all of it. We got some people that are getting treated in their car if they haven't reached a certain level. We got hospitals that are treating people that are the sickest that have ever been in that hospital ever before. We got folks that aren't stable enough to transfer. We have challenges transferring patients from hospital to hospital. The FEMA strike force is going to help that in the EMS, but we all ought to be significantly worried about our healthcare capacity. It is overwhelmed in certain regions, and it certainly is at risk to be fully overwhelmed statewide. Yeah. So on the testing side, as things were looking better, the full government payment of testing went away. The regular insurance and Medicaid, et cetera, portfolio of payees took over that system, and it has created challenges that we are addressing. For instance, up until recently, and I think we are getting it resolved, private insurers would only pay for your test if you were symptomatic. Well, right, what if you've been in contact with someone? What if you've been at an event with thousands of people not wearing masks? I mean, that's a time when we want you to get tested. So we've already fixed this in Medicaid, and that's one population, and we put out a bulletin for private insurers that we believe is going to get it addressed. But 2 other issues in testing. Number one, there's going to be a bit of a delay on supply chain where we may have some shortages of testing material. We've gone from, I don't want to call it a small amount of people getting tested, but certainly compared to before, to I think right now being about 5 times the number of people wanting to get tested on a given day that did 2 months ago. Second piece is, where are people going to get tested? And let me say this again. One of the reasons, and it's one of, that our hospitals are struggling is people are showing up to the ER to get a test. Don't go to the ER to get a test. And that's why we are using some CARES Act money to send private testing groups to the hardest hit hospitals to free up the clinical staff so that they can go help people who are sick and we can do the testing. It not only, I think, is working, but other hospitals are requesting it. So we're going to have to look at all of our funding sources because I believe that this is a constructive step and see how much more we can do. Yeah.
Update, is it going to take large numbers of deaths to spur the community to act?
So to have I could call a special session at any moment. That doesn't mean something positive would happen. We still have a number of important things in place because the state of emergency is still in place that we need to keep in place. It's the very minimum of what we need. We need other things to be put in place that some of which I think will be easy for the legislature. We need more NTI days for schools. We need virtual options to be acceptable. If you got to close school for a week, it shouldn't be that it's being tacked on at the end. We ought to be able to go virtual because we did before, and schools are getting slammed. And it's staffing, it's students, it's bus drivers, and we've got to give them the flexibility they need. But then there's the other steps that if we truly want to stop this surge and save lives, we have to implement. I think the legislature is going to need to do a statewide mask order, and that's going to be on them. I think they just projected nationwide we're going to lose 100,000 more people, half of which could be saved by universal masking. That's 50,000 people across the United States. That's a pretty good reason to do it. But again, I'm not just going to immediately call them in, and we do have some time. I want to give them an opportunity to review all the material. We have had constructive conversations and get to a point where we can achieve something through it. And I'm not going to wait or leverage to try to get everything. I'll take whatever tools they will give me, and I will fight my hardest. How successful we can be depends on the level of tools that we get. Yeah.
To Louisville, how many are there? What are they going to do specifically, and when will they arrive?
So they have arrived today, and we are working out all the mechanics and the communication with Louisville's regular EMS and others. I believe that there are 5 ambulances that will be there, but let me check on that. Those numbers have looked different between yesterday and today. But the goal in Louisville is to do the patient transfer between hospitals. The concern is that if Louisville's regular emergency EMS were to do that, then there could be shortages to run the regular emergency runs when someone is in bad shape. So this is to free up that capacity. Anybody else? All right, thank you all very much. And congratulations again to all the scholarship winners.
And please welcome Governor Kathy Hochul.
Good afternoon. We come for an occasion that makes us very proud. As the state begins a healing process dealing with COVID and other issues, there's no better place for our new governor to come to make this announcement than a community that has had to heal and struggle at the same time historically. This is a community that knows how to handle situations and keep functioning. And that is why it is very appropriate that the governor chose to make this announcement today. Now, we also want to make a note to you that we're not welcoming her to Harlem. She has been to Harlem more times than she can remember. And she has done it when she was not governor and not lieutenant governor. She's coming to deal with friends and people that have worked with her. So in many ways, it is her continuing in the bonding and the relationships that she's established down through the years. The day that it was announced that she was going to be governor, she called me and said, Reverend, the first thing I did was drop to my knees and ask God for guidance and ask God for strength. That's the kind of governor we need, someone that looks beyond themselves. She has chosen and will be announcing a son of Harlem that grew up in our community, that has been with National Action Network and NAACP all of his life. So all of you that don't know why Hazel and I are up here, because we've been with Brian from day one. So don't blame the governor, blame Brian's background. So it is my honor and privilege to welcome and bring to the podium, not as we would call her Kathy before, now the governor of the state of New York, Governor Kathy Hochul.
Good afternoon. Are we having fun yet, my friends? It is so great to be back in Harlem. There's such a vibe here.